I'm Elizabeth Moss with Caregivers by WholeCare. Happy New Year, everybody, because this is our first live Facebook interview of 2021. And we have Harry Perret back with us of Oak Tree Advisors. Harry is infamously known as the Medicare man. And we are happy to get to help understand how you can make Medicare, your policy work for you. And so, Harry, you have a lot of alphabets and acronyms and all of those things that you use day to day. And I know every industry has that same thing. And so we could have the same three letters and they're one thing for me and there's something very different for you. So we're going to help people understand what those mean in the Medicare world, right? And
Exactly.
um, you want to help people understand how they can make their policy work for them.
Every policy is different. There's over 50 policies here in Middle Tennessee,
Wow.
and Medicare is a federal program, but it's all driven by our zip codes. So it's everything based on where you live. Is you'll have different access to different policies based on the area code, the zip code that you live in.
That's confusing.
It's very
It is
confusing.
very confusing.
It
And
shouldn't be as complicated as it is, Elizabeth, but we are what we are. It's a federal program that started back with the Johnson administration, and they do a great job. But there's so much confusion and misunderstanding in the marketplace. And I hope today that we can just answer some questions that you've researched that we could talk about, and just allay some fears here. We
yes,
like to educate and give everybody the information so they can make the most informed decision for their health care.
absolutely. So you've recently written an article to publish, and I was reading that article, and so I had some questions. One of the things you talked about was original Medicare and the parts of that Medicare plan, which gets us into the alphabet letters that represent those different parts, and some details about, you know, how much they pay on each of those parts. So if you'll talk a little bit about original Medicare and the parts A, yeah, what is A, what is B, what is C, what is D, F, G, and N. Um, I guess let's start there.
That's a great question, and there's a lot of answers to that question because original Medicare is just A and B only, and A is hospitals. So if you work 10 years or 40 quarters in your lifetime, you have paid taxes that pay for Part A once you turn 65.
All of Part A, I mean,
All
all
of Part A. You have no more payments for Part A as long as you've worked 40 quarters in your lifetime.
but if you go to the hospital, does it pay 100% of that hospital bill because you paid all that in?
All right, now we're going into the weeds for a second. Before we
Okay.
go there, let me finish explaining a little bit about uh, original Medicare, because original Medicare is two parts. A for hospitals, B is for doctors. So when you go to the hospital, you can have charges both for the doctor, you can have charges for the hospital, you'll have charges for lab work, uh, and everything else that happens to you while you're in the hospital. It's amazing how many items are on that hospital
Mhm.
EOB when you leave, explanation of benefits when you leave. So original Medicare is based on an 80-20 rule, just like a lot of group health insurance is when we're under 65. So original Medicare pays 80% of, let's say it's a $100,000 medical bill, something major happened to you, and then you would be responsible for 20% of that bill. $20,000. And it's not capped. If you go back in the hospital, it's another 20% of that entire bill. So
Ah,
that's original Medicare. Um, What works for original Medicare is you can see any doctor, any hospital that takes Medicare anywhere in the country, which is fantastic. There's no network. What frightens me, I was with a client yesterday. He had basically hernia surgery, which is not unusual for somebody in their 60. He was 68, and he has original Medicare. He's now facing $8,000 of the bill that was not paid that he has to fund. So he's talking about pulling out a loan for his house, refinancing his house to pay a medical bill. And there were much better choices for him. And those were some of the other letters you talked about: C, D, F, G, and N.
And N. And then there's SEP and
Oh,
there's LIS.
there's a lots of letters in this alphabet soup. We don't
Yeah.
want to get ahead of ourselves because we want to
Okay.
simplify it. So when you turn 65, you are now eligible for Medicare. But let's say you're like you want to keep working past 65 and you have a qualified group health plan. What you'll have then is your group health plan will be primary. Medicare Part A, the hospital only, will be secondary for you while you're working past 65.
Ah,
Or if you retired and you want to go full on Medicare, you're doing consulting work, or you're living the high life, the Raleigh life of Raleigh, if you will, and you're retired, and then you must purchase Part B, which is the doctors of original Medicare. That covers Part B as doctors. Part B has a fee to it, a monthly fee based on your income from 2 years prior. So let's say you're married and you want to get original Medicare and you want to start at March 1st of 2021. The government looks at your income from 2019. So if it's under 150,000 family income, you'll pay the minimum, which is 148.50 per month for Part B. And now you have original Medicare. And what that gives you is the government will pay 80% of the bill. You're responsible for 20% of the bill. But Harry, that 20% of a bill is a lot of money. And I agree. If you want that 20% covered, what are your options? You have two options, Elizabeth. One is that letter C, C as in Charlie. Those are called Advantage plans.
oh, so
Anyone that
that is a
turns,
C plan. All Advantage plans are a C plan.
or C plans, exactly.
Okay, I didn't realize that.
So an Advantage plan, you can't really turn on a television a lot of times without seeing Advantage plans being advertised, or Joe Namath on the phone, on the television talking about Advantage plans, or everybody else. And what that is it's run by private companies. That's Cigna, Humana, Aetna. Um, there's a long list of, there's 50 of them, as I said earlier, here in Middle Tennessee that are available to us. And the key there is there's no additional charge for most of those plans. It's a zero premium outside of your Part B. You will always have Part B, that payment for Part B. All right. With an Advantage plan, there's no additional charge, and they add a lot of extra benefits for you. Some plans will have dental benefits up to $2,000, which is fantastic. They'll have vision, they'll have hearing aids, they'll have gym memberships, all fantastic. They're all extra benefits for you with Medicare. The key is you must stay in network. All of your doctors must be in that network that's in the Cigna network or Humana network or Blue Cross or
Just
Ascension,
like our regular health insurance, that
just like
we have to
regular
be
health
very
insurance.
careful. And
Just like under
so,
65, you must be in network. Some you can go out of network and pay a higher cost.
mhm.
Some plans, like a PPO, allows you to go out of network and pay higher cost with an Advantage plan. An HMO means you must only stay in network. You cannot go out of network. You have no coverage if you go out of network.
We've just been through this process, and so we have a P plan and an S plan. Those are the options, 2 S's and 1 P. And so it's, you have to look at the plans to make sure your doctor's group is in the one that,
Exactly.
and then you have to go with that one if you want to stay with your doctor.
And
Or
none of us like changing doctors.
no, that's our trusted advisor, like you are. You're our trusted advisor, and we are a trusted advisor. We don't want to change those people every time the insurance companies change their network
I
policy.
agree. And that leads to some other scenarios. But let's complete the third choice when you're turning 65 and want to get Medicare. To recap, first choice, original Medicare. Second choice is the Advantage plans at letter C. Now we go to those other letters we talked about, F, G, and N,
And D.
and V. Those are supplement plans. Supplement plans are also called Medigap. You can't have a government plan without a lot of different terms
Right.
going forward, right? And what a supplement plan does, um, let's say if it's Plan G, Plan G can be purchased if you're turning 65 today, this year, you can buy a Plan G. And what that gives you is all the advantages of original Medicare. Seeing any doctor anywhere in the country that takes Medicare or any hospital, you're covered. And then you pay a monthly fee for that, just like you do with group health insurance. And it's based on your age, not your health. So with turning 65, there are no underwriting questions.
Hmm.
You must be accepted in the plan without going through underwriting. And then with a Plan G, you would pay a deductible. Sounds familiar with an under 65 plan, correct?
Yes.
That deductible this year is $204.
Ah,
So let's go back to that $100,000 medical bill.
okay.
All right. With Plan G, a supplement plan or Medigap plan, you go to the hospital, your EOB comes out at $100,000. You would pay $204. You pay your deductible. Medicare pays 80% of that bill. Then your supplement plan pays the remaining 20% of that bill.
Okay, so instead of the 20,000, the 20%, it costs you 204.
That's
But
it.
how much is that supplement?
The supplement plan, if you're turning 65, it's based on your, again, your area, your zip code, where you live,
Oh,
and your age.
okay.
I am 67, and my wife is a little older. I'll keep her in age unprotected into the Facebook world, but she's older, and we're paying about 230 for both of us on a plan.
Oh, okay.
So very economical for both of us to have that plan.
But are you paying anything for, you're not paying anything for original Medicare because you've already paid all those taxes in. Is that
For Part
correct?
A, for
For
Part A,
Part
that's
A.
correct. You
And
both pay
then,
for Part B.
and then D is for drug plan, right?
And then you have to add a drug plan. Thank you, Elizabeth. With the supplement plan, you must buy a drug plan too. And again, the choices are long. We look at all of your prescriptions and find the right plan for you. And we make sure we find the preferred pharmacy versus the standard pharmacy or the out of network pharmacy.
Hmm.
If someone uses an out of network pharmacy, what happens to their drug cost?
They skyrocket.
Exactly.
And what about the specific drugs themselves?
Every plan is different.
Yeah.
So all the formularies are different for plans. So we must look at all your prescriptions and analyze them and find the right way to buy them. And here sometimes we have to get creative. Medicare does not play well with others.
Hmm.
Same with our veterans if they have VA benefits. Those are two separate mountains to themselves. They don't play well with others. You can't combine a free program like GoodRx is a free program.
Oh, uh-huh.
You can't combine GoodRx with your Medicare plan, drug plan D, and get a cheaper price for your prescriptions. But,
Well, because there's nothing cheaper than free, right?
right, nothing's cheaper than free. But you can have GoodRx in your back pocket, if you will, or on your phone or on your computer. You can put in the prescription you're taking and price it with the pharmacies around your house.
Mm-hmm.
And then you can get a price with your drug plan. Whichever one's cheaper, you use it.
Okay.
You don't have to, you can't combine the two together, but you can use them separately. Does that make sense?
Mm-hmm.
And some of my clients even go out of the country, use a
Mm-hmm.
Canadian pharmacy or a pharmacy in
Mexico.
England
Oh,
and get, because we're all guidelines are under the FDA and all of our prices are controlled by the FDA and the pharmaceutical companies. And sometimes it's cheaper to go out of country and have it mailed to your house to do that. And we get creative to help people lower cost to save them money because that's typically is the highest cost for someone is their prescription cost on a monthly basis.
so if there, I want to repeat what I just heard you say so that everybody makes sure that is, you hear that. We work with our clients to lower costs. And so Harry is a trusted advisor and knows Medicare inside and out. And so it's worth a call, an email, something to have that conversation if you're looking to lower costs on any of these uh, alphabet letters.
Exactly,
Okay, yes, thank you.
100%. So we talked about all the letters there that you read off earlier, and you threw in some other ones as well.
SCP. In my
SC,
mind, that goes to um, it's a SEP plan. It's a retirement account.
right, right. In that world, that means a SEP account is a retirement account. In the Medicare world, that means it's a special event.
Ah,
So you relocated from, you moved in from California to Tennessee, and the plan you had with Medicare in California is not, does not operate in the state of Tennessee. That is a special event. Or you got
okay.
a divorce, special event. You're coming off a group health plan and you want to go into Medicare, that's a special event. So you can change your insurance. You don't have to wait for AEP, some other letters out there, which is annual enrollment period,
Ah,
which runs from October 15th to December 7th, where everyone with an Advantage plan can look at their plan for next year and make a choice. And there's some other letters that's going on right now. Do you know those letters in Medicare world during the first 3 months of the year?
it's not open enrollment. It's, no, I don't.
Okay, it's called OEP. And oddly enough, it's called open enrollment.
Oh, okay. It
Open
is open.
enrollment period. You were right.
Okay.
OEP cannot be advertised. You can't run ads saying it's open enrollment. Please come talk to me and I'll review your plan. But what happens? Did you ever buy a car, Elizabeth, and not test drive a car?
No,
Never.
I haven't.
Myself either. And 2 years ago, Medicare decided, okay, that makes sense for Medicare plans too, because things change from October when you purchased a plan to January when you wanted to use a plan. Let's
Uh,
say a doctor left that plan. She
right.
moved to another plan. She's not taking that plan anymore. Or a hospital. A few years ago, one of our major hospitals here, Vanderbilt, left Blue Cross. Blue
Ah,
Cross said they left Vanderbilt, but who
right.
knows? But that left everybody had signed up. Well, my doctor doesn't take my plan. What do I do? In the first 3 months of this year, till March 31st, if you have an Advantage plan, that plan C, C as in Charlie, you can now switch one time from one Advantage plan to another Advantage plan that your doctor takes or that has better prices for your prescriptions because you have new prescriptions that you didn't know about when you reviewed your
Mhm.
plan in October. Only from now till March 31st, one time you can change with an Advantage plan.
Okay. Okay. So it's essentially 6 months of open enrollment, but nobody can really call the second 3 months open enrollment. It just is for the test drive.
Yeah, exactly.
Mhm.
Yeah. They call it AEP versus OEP. AEP is the annual
Yeah, I
enrollment.
don't understand the government and really at all, but
We're not going into that rabbit hole.
I can think of much better letters to call these plans than the letters they chose.
I
That's for
agree.
sure. The ones that people could remember and that make sense. You
Yep.
would know which plan it is by those letters. So you covered A, B, C, D, and F. What
F,
about,
G, and N are form and V are form of supplement plans.
okay.
Those are all different types of
Oh,
supplement
all
plans.
three of those are
Yeah. And then
supplement
there's, you
plans.
mentioned earlier, LIS.
Yes.
LIS is also called Medicare Extra Help. Again, there's always multiple terms for the same thing. Um, LIS stands for low income subsidy. So
Okay.
if someone has limited income and limited resources, they can qualify for Medicare Extra Help or LIS. And what that does, it'll save them, according to Social Security, $5,000 a year on their prescription cost, which is phenomenal.
Yeah.
So what it does is if someone's taking, as you know, Elizabeth, prescriptions are broken down into 5 different categories. Tier 1 and 2 are generics. They're typically inexpensive. Tier 3 and 4 are brand drugs, which means what?
That
More dollar
means,
signs.
right. Well, yeah.
Yeah,
Yeah.
exactly. And
And
then
they're newer drugs
and
too,
they're
aren't
newer
they?
drugs,
They're
right?
newer. Yeah.
They're newer drugs, and then type 5 or compound drugs. They're
Oh,
custom made drugs.
mhm.
So if someone's taking a tier 3 or tier 4 brand drug, and let's say it's Eliquis, which is the new blood thinner drug, it's $500 on their plan.
Oh my. For 30 days?
Yes, that's outrageous.
Yeah.
So if they qualify for Medicare Extra Help, what that does is that same $500 drug now costs $875.
$8.75.
$8.75 because they qualified for Medicare Extra Help. And I can help people get that if they qualify by going through ssa.gov and helping them sign up for that.
Okay.
That we get answers in 2 to 3 weeks. Those that want help in paying for their Part B payment, that 148.50 we talked about earlier,
Hmm.
they have to qualify for TennCare, which is Medicaid.
Yeah. Okay.
And that's a different process. That takes 2 to 3 months to get an answer there.
So
And it's
this
all about,
LIS is a quick turnaround.
oh, 2 to 3 weeks is quick when you're dealing with the government.
Right.
It's very quick.
Yes. Especially in comparison to months.
Oh, yes, yes.
Mhm. Let me check to see if we have any questions over here. I don't see that we do. Um, okay, so I'll keep going. And I had a couple of questions about your article. Um, so I want to go back. When you keep saying 65 years old, um, my mind goes to Social Security and 65, 67, 70 years old. And so these are very different, correct? Okay. Everybody has to be signed up when they're 65 for Medicare. Is that correct?
Yes, and there's always a but to it too, Elizabeth.
Because I remembered hearing that last time and I didn't know that.
All right, so Medicare, the standard rule is when you turn 65, you are eligible for Medicare. And if you work those 10 years, 40 quarters, you get Part A. you must enroll in Part B yourself. But there are people that are under 65 that also have Medicare. How do they get Medicare? They get Medicare because they've been on disability for 2 years. If
Uh,
you've been on disability for 2 years, they're automatically move into Medicare and have A and B.
at 63.
Or it could be 60. I've seen them as young as 20
Oh, okay,
have
but they just
Medicare.
have to have that 2 year
2 years
window
of
of time that
disability.
they're disabled. Okay,
Exactly. Then they get Medicare.
I see.
And then they're eligible for Advantage plans or 10 care. They could buy a supplement plan at that age, but it's real expensive under the age of 65.
Okay. Well, gosh, I learned something from you every single time we talk. Um, so the costs, oh, sorry, I didn't turn off all my notifications here. So planning, when do we need to start looking at this? If we're not disabled, we're 60 years old, I'm learning from you, so I will be prepared. But for those who aren't in this world and get to talk to you regularly and learn from you, when should we start thinking and planning for this to get signed up?
Uh, People can call me a year in advance and talk about it. Typically, I say we'll really get into how to do this about 4 months prior to when you need it.
Okay.
So if your birthday's in May of, you were born in 56, May of 56, May 1st of 2021, you're eligible for Medicare. So we can
Oh,
apply for Medicare Part A and B 3 months prior to that. So that would be February 1st is 3 months prior to that. So we can apply for Medicare Part A and B if we want that to start April 1st. If your birthday is April 30th of 1956, Medicare starts for you April 1st of 2021.
okay.
It's always the first day of the month that you turn 65.
Okay.
And if you want to keep working past 65, that's fine. Medicare Part A just comes in as a secondary to your group insurance. If you don't get Medicare when you turn 65 and you're eligible and you decide you don't want health insurance, you don't want a drug plan, or you don't want to pay for Part B, there'll be penalties that are assessed when you do get Part B and Part D for the rest of your life.
Wow. And so that's not part D,
Part D is a drug plan.
right? You don't get penalized for that. You get penalized for A. There's something in the back of my mind that is remembering you saying that we needed to sign up for Part D, whether we were on prescriptions or not.
Exactly.
Okay.
Exactly. Because if you don't, when you decide to get it, it's basically the average comes out to about $3.27 a month for every month you didn't have it. So I had an orthodontist, retired orthodontist, 74, 75, and he decided he wanted to get a drug plan because he was starting to take some more expensive medications, him and his wife. And he had to be paid 10 years of penalties, which will pay the rest of his life. So
Wow.
327 times 12 months times 10 years is his penalty. And he pays
Wow.
that the rest of his
Three
life
dollars and 27 cents
on an average. Yes.
on average, okay, per month
Plus, yes,
times 10 years.
because that's how long he was
Wow.
going without his Part
Yeah,
D.
it's much harder to come up with that 10 years later than all at once than it is
No, and,
3.27.
a drug plan can, this year, a drug plan here in Tennessee is as low as $7.30, and it goes up from there.
Okay.
It's all based on what prescriptions you're taking and finding the formulary that fits that. And we do that by looking at all the plans. I'm a broker, Elizabeth, so I have access to all the plans. I have no I have loyalty. Some plans are better than others. They're rated by star systems from 3 to 5 stars. And so I like plans based on higher ratings because that means CMS, Centers for Medicare and Medicaid Services, which oversees Medicare, rates it highly. Hospitals and doctors and thus that use it rate it high. So I look at the star rating. I also look at the prescription cost, the doctor cost, and what co-pays and co-shares I may have with a plan
Okay.
to make that decision.
All right. Well, it's still, even though I've learned all this, I won't retain all of it. It'll be bits and pieces that I retain. So will you tell people, I have one more question, but I'd like you to tell people how to call you, because I know this is so helpful and it will be to many people.
And I love what I do, and I love to help people, Elizabeth, as you do.
Yes.
You're a shining light in what you do in the
Thank
home
you.
healthcare
You are
industry.
too.
And I bring that same passion for helping people to the Medicare world. My company is The Oak Tree Advisors. So my website is theoaktreeadvisors.com. Or you can email me at Harry, Harry, at theoaktreeadvisors.com. Um, I'm on Facebook with my company as well. Elizabeth, you can always call uh,
Yes.
WholeCare Connections. The whole team there knows me and they can connect you as well. But it's theoaktreeadvisors.com or Harry at theoaktreeadvisors.com. The two great and easy ways to get a hold of me.
Yes. And you can, comment in the section on the Facebook Live comments, and either one of us can get back to you. My last question, and one that we get all the time because we're in home care and Medicare is health care, and people think of us as health care. And so many people think that Medicare pays for all of home care 24/7. And so that's a rude awakening for many people who really want to stay at home and age in place, and then realize that those resources are not available to them. You and I have spoken a few times about Medicare has said and is paying for some home care. Now, again, some is the key word. In the home health world, when you have a hospitalization and you need therapy at home, home health and Medicare does pay 100%, is my understanding of home health, comes into your home. But that is episodic care. That means you had an episode, you need a little bit of support, and they put that in place for maybe 3 weeks and maybe 2 or 3 times a week at 45 minutes each visit. That's home health. Home care, it's all very confusing. We provide extended caregivers in the home that helps you be able to age in place, and we can prepare meals and help with hygiene and bathing and transportation and lots of things. And all of that is to say that Medicare is paying for some of that home care right now. My experience is it's very similar to the home health. It's episodic, and it will be very short term, and it will be short periods of time. um, so do you know any more about that from the Medicare perspective?
Medicare is like walking up to a pond and putting their foot in the water and they're kind of testing it.
Yeah.
I think it's going to expand, but it's some plans have it and we can review that individually for you and offer that, but it's very limited. It has to be doctor ordered. There's a lot of weaknesses with a plan. What I look at with a Medicare plan is to minimize those weaknesses and minimize financial gaps. There are two big ones. Home health care is a big financial gap because we all want to, most, you're, the trend is to age at home, particularly with this pandemic. We prefer
Yeah.
to be with our loved ones at home than in a nursing home. And then long-term care. Medicare does not cover long-term care. It does not cover long-term care for home health care. So it's real important to work with someone that can help with getting you a long-term care policy that'll help pay for the services of taking care of you at home. And we're fortunate, Elizabeth and I, knowing a comrade, a good friend who's exceptional at what she does
Mhm.
and is a specialist in long-term care.
Long-term care
And
insurance.
that's
Yeah,
Dallas Doucette. That's
yeah.
all she does. And I highly recommend, if you look at long-term care, it's an investment in your health as you age.
It allows many, many people to stay home. There
Right.
are times that, there are times that people really aren't safe to stay at home, even with 24-hour care. And there are families who need 24-hour care, and long-term care insurance doesn't pay for the whole 24, hours or 7 days a week for years on end.
Right.
And so it's a case by case situation. However, with that said, there's a lot of care that can be provided at home before anybody really needs to go anywhere. And so call us, talk about that, talk about Harry, about your Medicare plans. And yes, Dallas Duche, who I've interviewed on Facebook before, um, call me. I can, get her information to you. And is there anything last minute that you'd like to share with everybody again, Harry?
Yeah, just to recap, it's real important with your prescription plan. Make sure you're using a preferred pharmacy with your plan. A lot of plans don't tell you what the preferred pharmacies are, but if you want to reach out to me, I can help you find that out and make sure you've got a preferred pharmacy to lower your drug costs and save you money today. And if we need to look outside the box and maybe use a Canadian pharmacy or European pharmacy, I can help you analyze that and look to save you money with your pharmacies today.
Great. Thank you, Harry.
This was wonderful.
Your passion does shine through, and it's always refreshing. What a boring topic Medicare is, but you make it not boring.
I
You
love it. I've thoroughly
create
enjoyed it.
curiosity and engagement when I'm thinking and talking about it with you. So thank you. And again, y'all can reach Harry at harry@theoaktreeadvisors.com. We'll see you soon. Thank you.